Hi, my name is Pooja Ghatalia. I'm a medical oncologist at Fox Chase Cancer Center, and I'm going to be summarizing the updates for ASCO 2021 for kidney and bladder cancer. So first, I'm going to be talking to you about kidney cancer, and there's data from the Keynote 364 study in which adjuvant pembrolizumab was compared to placebo in patients with localized kidney cancer status post-nephrectomy. The primary endpoint of the study was disease-free survival, and it was a positive study with the disease-free survival improving by 10% compared to placebo. Updated overall survival data are awaited. Then there was a study with frontline metastatic RCC, the Keynote 426 study, with updated 42-month data from the pembrolizumab exitinib versus sunitinib in the frontline metastatic RCC phase 3 data. In this study, there continued to remain an improvement in pembrolizumab exitinib versus sunitinib as far as overall survival and progression-free survival are concerned. There was some subgroup analysis data which showed that in the favorable risk patients, the improvement in overall survival in the pembro-axi versus sunitinib was not significantly better in the combination arm. However, this was a small group of patients and it was an unplanned subgroup analysis. The use of IO-based regimen in the frontline setting is highly recommended. In the non-clear cell RCC space, there was a trial using a combination of IO-TKI in the frontline setting, cabozantinib plus nivolumab, for papillary RCC patients and also some other non-clear cell RCC tumor types. There were 40 patients in this single-arm study, and the combination of cabo-nivo in patients with non-clear cell RCC was almost 50%, which is very encouraging. And further studies in non-clear cell RCC are needed to understand the impact of combination IO-TKI in this group of patients. In the SWOG 1605, which is a study of Tessarizumab in non-muscle invasive BCG refractory bladder cancer patients, Tessarizumab was given for a year, and the primary endpoint of this study of CR rate at 6 months in the CIS population was previously presented. It was at 27%, and now event-free survival data is also available for these patients. It seems like the CR and the EFS rate, they continue to drop over time, and ideally a durability of response is highly desirable in these patients receiving PD-1, PD-L1 blockade. There is data from Dr. Galski's GEMSIS plus NIVO study in the bladder sparing space with a design similar to the RETAIN study presented at GU ASCO this year. Based on that data, bladder sparing approaches are feasible and attractive to patients, but better approaches to refine the clinical complete response assessment is really necessary to improve outcomes in these patients, and long-term follow-up with 2-year metastases-free survival data, especially in the active surveillance patients, is going to be very informative. Finally, data with trimodality therapy using radiation therapy in muscle-invasive bladder cancer. We have data from the immunopreserve study, which used durvalumab tremelimumab with radiation therapy in patients who were not able to receive cystectomy. And there's also data from Dr. Ballar's study using gemcitabine with radiation therapy and pembrolizumab in this setting. And both of those studies showed encouraging bladder intact disease-free survival data. And longer follow-up is needed to see the safety of this approach. Data from the Keynote 992 study, a phase 3 trial comparing chemoradiation with or without pembrolizumab, is awaited. Thank you very much.